Ask the Messengers, the program that deals with substance abuse, real people telling real stories. Hosted by Pastor Lester Lewis, co-host Charlize Wilkerson and Leroy Kerr. Where there is addiction, there is a chance for recovery. We're trying to help save lives on Ask the Messengers.
Thank you for tuning in and welcome to the show. I am Lester Lewis, your host. We've got an exciting show lined up for you today. On Ask the Messengers, we sit and talk with Dr. Joneigh Khaldun. She is the Chief Medical Executive and Chief Deputy Director for Health of the Michigan Department of Health and Human Services. Now, in that capacity, she gives medical guidance to the state of Michigan and also oversees population health and behavioral health. Today, we're going to ask her and talk about the opioid epidemic as well as the outbreak which is happening with vaping. But most importantly, she's going to share some aspects and suggestions that the Michigan Department of Health and Human Services would like everyone to know regarding vaping. Now, before we hear from Dr. Khaldun, let's first hear from a real person sharing their real story.
What is vaping?
Well, vaping is pretty much a nicotine cover-up is the best thing to say, because most people, they have different ways of vaping. Most people vape to quit cigarettes or quit any tobacco products. Some people just be vaping just for the fun. But really, if you vaping just for fun or you vaping to quit cigarettes, there's a very high possibility chance of either death or serious injuries.
Do you vape?
Yes.
Dr. Khaldun, thank you for being on the show. And can you tell our viewers what is meant by a vaping outbreak?
Yeah, so thank you so much for having me on the show today. I'm really excited to be here. So what we see with this vaping outbreak is that basically across the country, we have seen thousands of people who have been injured related to vaping devices. And so what's been happening is that, unfortunately, the chemicals that are in these vaping devices are coming in contact with people's lungs and causing them to get really, really sick. And we've even seen several deaths. In the state of Michigan, we've had over 65 cases to date, and actually 3 people who have died because of these illnesses.
All right. So now, and so because of that, it's happening over lines. So in other words, it's not just young people, it's also older people. It's not just, it's across the board. So that's why it's being called an outbreak.
Exactly. It's an outbreak because it's all across the country, and it happened really quickly over the past several months. Actually started last summer. And we don't 100% know exactly what is causing it. What we do know, however, is that over 80% of people who had these illnesses, they were vaping THC. And so what we are recommending for everyone is that they avoid vaping any products that have THC in them, that they, if they can, avoid vaping any products at all. And certainly for anyone who is a child, any youth, any pregnant woman, they should not be vaping at all. Whether it's a THC product, nicotine product, they should not be vaping at all.
I started vaping. I started with just the regular little my vapors, pretty much like the e-liquid without nicotine, without all that extra ingredients. I started when I was 19.
Did you start to quit cigarettes?
No, I wasn't smoking cigarettes at the time, but I did start vaping to quit smoking weed. That was what helped me stop having such a crave. I have a vape, I hit it like 1 or 2 times and then I put it down.
But they vape with weed too now, don't they?
Yep, they got the THC cartridges, and they have also, some people will make homemade wax cartridges. And both cartridges are really bad because the THC cartridge now, some people putting fentanyl in it. Some people is doing too much with it. They smoking them like they smoking a blunt. And if you smoke it like you smoking a blunt or you're using it as a replacement, that also is going to shut down your lungs.
Have you ever had any type of bad experience with vaping or?
I never per se had a bad experience, but I know a bunch of people that had they had shortness of breath all the time. You know, they lost their voice. Some people get bad wheezing coughs, you know, and I also had 3 friends last year that died from vaping. For all you kids and all you adults that are buying and submitting to using vapes as a replacement or as a stress relief, something to clear your mind, don't do it. It's not good, it's not safe, no matter how you hit them, how you use them, or what you're using. Think about your life, because these will take off some years. Most definitely will take off some years, and they will also take you away from your family.
Now, recently your office issued a press release regarding 2 deaths, and now it's 3 here in Michigan, and about vaping-related lung injuries. And so you have some recommendations that you would like to speak to our viewers and to everyone regarding vaping.
Yes, this is very, very serious. We don't want anyone to come in contact with these products that could be unsafe. So our number 1 recommendation is to avoid vaping any product that has THC in it, and especially if that product comes from like a friend or a family member. It doesn't come from an actual shop. We also are recommending, again, that no one, if you're a young person, if you are pregnant, no one should be vaping any products ever. And especially, you should not be using a chemical called vitamin E acetate. That has been really closely associated with these illnesses across the country, and no one should be adding vitamin E acetate to their vaping products at all.
There's an epidemic spreading. Scientists say it can change your brain. It can release dangerous chemicals like formaldehyde into your bloodstream. It can expose your lungs to acrolein, which can cause irreversible damage. It's not a parasite, not a virus, not an infection. It's vaping.
Opiates has taken everything and everyone I've ever loved away from me. I just wish I would have had a warning.
My drug of choice was mostly prescription pain pills. I had appendicitis one evening, and I went to the hospital and they found a mass during a CAT scan, and the mass they thought was cancerous. And so after appendicitis surgery, I ended up with back surgery and had to remove my uterus, so I had a hysterectomy. And from there, it was just 5 years of different opiates being prescribed to me by doctors through different surgeries. I was able to get them through that period of time through doctors. You know, at one point they did end it after a year of 120 pills a month for a year. And at that end of that year, I got a letter in the mail saying, you're not gonna get this anymore. So, you know, my blaming the doctors at this point isn't gonna do me any good, but I do work towards getting doctors to understand tapering and how to help somebody that is in active addiction instead of just cutting them off, because we know where that leads. I don't know if you knew my story, but it went across all the news channels. And I was an assistant principal for 24 years in the Troy School District, and went into a home that wasn't my own and looking for prescription drugs because I had run out and there was nothing. I didn't want to go through withdrawals, and I didn't want to, you know, go back to another doctor, so I thought that'd be the easiest way. And unfortunately, they had cameras in their home, or fortunately, because it led me to get help. And I was arrested, lost my job, had to sell my house, went to treatment out in California for 30 days, came back and started to rebuild my life. And so the last 2 years, that's what I've been doing. Started in March of 2018, this was my first rehab. And then you know, worked at an animal shelter for $9.50 an hour, and then worked my way all the way up to where I'm at now.
Now, also, we're dealing with currently an opioid epidemic. Now, how is the Michigan Department of Health and Human Services addressing that issue?
Yeah, this opioid crisis has been, again, impacting the entire country. What we've seen in the state of Michigan is that in 2018, over 2,000 people died just related to opioid overdoses. And so what we're doing in the state is trying to tackle it from all ends. So making sure people don't get inappropriate access to opioids, making sure that anyone who's struggling with a substance use disorder, they have access to treatment. Treatment works, and it's okay to ask for help and get treatment. and we want to make sure everyone understands how to save a life. And so we're working on making sure everyone has access to the overdose reversal drug called naloxone, and we want to make sure that people, if they are using substances, particularly if they are IV opioids, so heroin, we want to make sure they have safe and clean syringes. So we're expanding access to syringe exchange programs across the state.
All right. So now, what programs and initiatives does your office have in place for, and when we say substance abuse, we also don't want to omit or forget that alcohol is a substance as well. What kind of programs are available?
So we have a lot, and we work really closely with our partners. So our behavioral health system, we have that here in the Detroit metro area, and we also work a lot with our local health departments. So some of those things are making sure people, again, have access to treatment. We're working with our emergency departments so that when people come through the emergency departments, they can ask for and even start treatment there. We are actually launching a naloxone program, so that overdose reversal drug, so that people can actually go online and actually get access to that medication. And again, also working through our syringe exchange or syringe service programs across the state. So there are a lot of different programs. We encourage everyone, and this is very important, we really have to address the stigma when it comes to substance use disorders. It's not a moral failing. Anyone is at risk, and anyone can get treatment, and it's okay to ask for help.
My drug of choice was prescription painkillers.
And how long did you use?
I used prescription painkillers from the ages of 17 until about 32, 33.
And how were you able to get a hold to it?
It started with a basketball injury. I fell and busted my elbow on the court, and ironically enough, the doctor put me on them.
And how long were you using?
I was using, once I hit about 20, it was daily, all day, every day, as much as I could.
And what brought you to your knees where you said, look, enough is enough?
The pain became so great that the drugs no longer worked. It didn't mask anything. It didn't make the pain go away. It was still there, and you know, it crushed me. It buckled me.
How did you know where to go get help at?
My aunt, thank God for her, she Googled it, and we found out about Sacred Heart.
Okay, and how long you been clean now?
I'm actually currently in their program right now, working on getting clean. In the past, I've had a year and a half clean, so I know a little bit about recovery.
Okay, so I want you to look in the camera and give somebody a hope shot that's maybe thinking about using painkillers and don't know what road they about to go down. Look in that camera and give them some hope.
If I could give anybody any bit of message or hope, it would be that, you know, it doesn't matter if you're injured, if you're going through something physically, emotionally, the drugs aren't gonna help. Take care of yourself, take care of your body, and just find like-minded people who want to help others like you. I mean, it's not worth it. I've lost so much due to this, and there's not an amount of drugs in the world that's gonna mask anything you're feeling. You gotta change your heart, and you're gonna change your mind, and then you're gonna change the way you feel, and that's what this is all about. And love each other, man. Love each other.
Yeah, can you tell me, Mike, what's your drug of choice?
Opiates, pills, Percocets.
Okay, and how long have you been using?
Since about 2 years ago.
And what's your clean date?
Approximately a week now.
A week. Congratulations, man.
Thank you so much.
Absolutely, yeah. Can you tell me a little bit of how your drug addiction and or alcohol affected your life and your family?
Absolutely. It caused me to lose my family, actually. I got a divorce. I'm in court now battling while fighting for rights to see my daughter, who is my life. And that's the reason why I'm here. And one of the reasons that I'm here also is I have a lot of family support. I wasn't raised in a broken up home, so I don't have that excuse. I just didn't know where to go, how to do it. I'm Muslim, so I grew up in a Muslim household, very strict mother and father, but they gave us everything we ever needed. I had everything I ever wanted. I just resorted to it. No one put a gun to my head, but I was around the wrong people. And I just did it. I liked it too much, and I got addicted.
Okay, and what was it that finally made you want to stop?
I went back to God and realized that my life was nothing without Him, and I guess you could say that I found the light again and realized that I was worth more and deserved more.
Excellent, excellent. Well, we're so glad to have you today. And can you look into the camera and give a hope shout to those that might be struggling with the same issues?
Yeah, absolutely. I mean, all of us go through things. It's just a matter of knowing that you're worth more, that you deserve more, and everyone needs a higher power in order to get through it, because no one can do it alone. I thought I could do it alone, and I failed every time. As soon as I turned to God, I feel like now it's not super easy, but it's a whole lot easier, and I'm more determined than ever.
I had a couple of surgeries here, so they gave me like 1,000 milligrams. And I mean, you know, the pain was there, but I started taking 1, then 2, then 5. Ooh-wee.
My drug of choice was pills.
And what type of pills did you take?
Norcos, Percocets, Xanax, Tylenol, Force, any type of downer, basically.
And how old are you?
I'm 30.
And how old were you when you first picked up your first drug?
14.
And how were you able to get to it?
Well, my first drug was weed, and then weed just escalated to me popping pills.
So how was you able to get home to the weed?
The weed man stayed next door. I just walk next door and knock on the door.
What made you hit your bottom?
Relationships, grandfather passing, just anything that was sad in my life, it just made me pick up pills even heavier.
How did your using affect your relationship with your family?
I pretty much kept it from my family. Like, my sister and brothers knew, but like, as far as like grandma and mama and daddy and them, they really didn't know. Cause I isolate myself from anybody who wasn't doing what I was doing. I just keep my distance.
So do they know now?
Yeah, they know now, yeah.
And how did that affect your relationship with them?
They was mad. My dad, he got 19 years clean, so he really wasn't feeling it. My mama, she, you know, everybody was disappointed, but, you know, I had to learn and go through it the hard way.
So when you hit your bottom, what did you do to go get help?
My dad, we rode around and he had a conversation with me, and he was just basically letting me know like how his life was. And now that his life done turned around, he driving 2019 Cadillacs, and you know, he done changed his life, and my pill intake could increase to me doing something more. So I knew I had to, and plus I was losing everything. You can't keep nothing if you have an addiction or something.
So if it was somebody your age out there thinking about picking up some marijuana or some pills, what would you say to that person to stop them?
I tell them to hold up. They might think it might just be for fun or a recreational drug, but if it's something that you like, you're gonna want to do it more, and then you're not even knowing that you becoming addicted to it. Because you only know once you ain't got it, you will feel different. You'll go looking for it, you know. So I just tell them, like, you know, don't even waste your time with it, because you're gonna lose everything.
I relapsed on pills. I got in 2 bad car accidents. I used to eat pills by the fistful. You know, an average person, they paying $90 to get us, you know, to get a fistful of pills and stuff like that. I was dropping that like Tic Tacs. I mean, I said, well, it ain't my drug of choice. I was fooling myself. So I had them reservations in the background. My father just passed. My little niece who I raised, you know, she dropped dead and stuff like that with stage 4 cancer. So it was just, you know, it was overwhelming and I couldn't handle it.
Dr. Khaldun, we would like to thank you so very much for taking out of your busy schedule to come and to share information and to help those of our viewers, and for those who will be exposed to this in any way, shape, or form, that the Michigan Department of Health and Human Services is here to help and to provide services to those who are in need.
So if anyone wants to find out more information about the opioid epidemic or about these vaping illnesses, they can go to our website or they can call our phone number.
Won't you help us to do exactly what our motto is, and that is to help save lives? Won't you send a generous donation to the information there on the screen? We would love to have you as part of our partnership to help save lives. You may not be able to go out in the street, you may not be able to come here to the show, but you can send your donation that helps us save lives.
Our prayers and our sympathy go out to those who have lost loved ones as a result of their battle with addictions. Though they may not be with us physically, their light will forever shine within the spirits and within those family members who have been left behind. Ask the Messengers, we offer these prayers up for you.
God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference.